I'd like to start off with a bit of an interactive question. Show of hands for the entrepreneurs in the room. And to those who either fancy themselves or wish they were entrepreneurs. Wonderful. So a number of years ago, and this will be sort of the underlying theme, I suppose, of what makes our venture a bit unique. A number of years ago, the San Francisco Chronicle newspaper quoted me as saying that my definition of entrepreneurship is finding a way to stay alive until the market is ready for what you have to offer. In other words, the task of the entrepreneur is essentially to see the future. Certainly a theme of this event. I think we would all agree, trying to figure out what that future looks like and basically be there waiting when the present catches up to the future. So the arena in which my organization, Beyond Lucid Technologies, operates is truly ubiquitous. It's a bit unique in its ubiquity. You'll see in a few slides as a caption that I want to underscore, the siren as the soundtrack of the city. But modern events being what they are, as some of you will no doubt know, yesterday was September 11th, 18 years since a day that truly changed the world, at least for some of us. And so the idea of bringing technology into an industry that has been operating successfully, but in the same way for many years. There is a phrase within the fire service in particular, a division of the emergency medical services, although I'd probably be slugged by some people for saying that, that the fire service is 150 years of tradition uninterrupted by change. That's one of the phrases they use to describe themselves. And of course, the topic of technology being how we can thrust the industries into the future using innovative tools and technologies that exist around us. So I'm going to walk you through some of what the team that has been called Silicon Valley's Emergency Medical Technology Experts has brought to market. And more importantly, perhaps, why we've brought to market. And so that was asked to be the topic of my discussion today. So the mission and what drives us, what makes us a bit of a unique organization, how we've survived for 10 years. In May of this past year, we reached our 10-year birthday. We are a small team of wily bandits, so to speak, who come from industries mostly outside of EMS. And because of that have been somewhat iconoclastic in our ability to look at things differently, perhaps, than those who've come up within the industry. And this seems to be a theme that we're encountering more and more among technologies that are disruptive, that certainly try to inform themselves, be engaging with stakeholders on the ground to understand their experience, but bring experiences, bring perspectives from outside. So once upon a time, I used to say that no one gets into emergency medical services by accident. I have evolved that statement, as it were, to say nobody stays in emergency medical services by accident. Complex industry, the stuff that you see is not quite like it is on television. In some ways more mundane. They don't really show in most television programs the number of diapers that need to get changed among old people. At the same time, the gore and the violence and the need is so much more profound than you can ever imagine. I've written articles about this I'd be happy to share, literally called Why Technologists Should Ride the Truck. It's truly impossible to understand the degree of need, the degree of urgency and immediacy of data collection, data transmission, and analytic opportunity. Again, all the stuff of AI until you've truly been in the back of the truck with the lights and sirens going. It's a singular experience. And as you can see, the subjects here that keep us going are, we really don't have any option. They're mission driven, right? We exist to serve the providers that are our partner clients, the fire and EMS agencies of the world, particularly now in 27 US states, 3 countries. But this is a global opportunity and a global need. Emergency medical services, again, everywhere that people are, things go wrong. People need to be there to save the day. We serve our partner clients on behalf of their patients. And then, of course, our team to make sure that we are fully capable of meeting the challenges that go forward. But at the same time, we can't quit. And that's really where the mission drives us, even on the hard days. Because again, all the entrepreneurs in the room know there are the hard days, there are the lonely days. Being a team of disruptors, the dinosaurs don't go down without a fight, shall we say. So I'm going to show you real quick a small video that just kind of encapsulates about 20 seconds, but it gives you a sense of why we do that which we do.
I'm Christian Witt, President and CTO of Beyond Lucid Technologies. And we're dedicated to my father and my sister, who were killed in an automobile accident 300 miles outside of Albuquerque. That day, the EMTs were not able to send on to the hospital What was happening? What was their situation? They weren't able to activate a triage team before they ever arrived.
And again, as everybody knows, yesterday was September 11th, right? So when I talk about the urgency of the moment and how the future has essentially caught up with us, times being what they are, really no matter where you are in the world right now, certainly in the United States, we're talking about events like a shooting at a garlic festival in Gilroy, California. We're talking about 250 people mowed down at a concert from a hotel room in Las Vegas, shootings at schools far too often. And whether you're talking about small events or large events, the guys and women that we serve are there every time. It takes a special type of person to run toward the crisis, to put to put their hands into the fire, to rip a person out of the crash, to bring them back to life. And that is just the urgent events. Those are only about a quarter or so of the events they deal with on a daily basis. There are cats that end up in trees and people get called to bring them down. So we exist and have brought technology to the market, including the first instances of telemedicine in the back of an ambulance built into a patient care record. Not rocket science. A picture's worth 1,000 words. How is it that a small team of outsiders was the first to realize that taking a picture of a patient's ID, wound site insurance, for example, and even, for instance, using things like biometrics could actually change the engagement and the ability to identify positively a patient? Because why are we relying on them to tell you their name when they've been in a crisis when we have a positive ID right here, or a toe or an eye? The ability to use these systems offline because tornadoes happen, hurricanes happen, earthquakes happen, major wildfires happen, and there's a whole lot of people who don't live within cell signals. So these are the types of technology that we've brought to market, again, to serve what has truly emerged among very few others as a ubiquitous industry. No matter where you go, the soundtrack, the siren of the city, the siren is the soundtrack of the city. And as we know, more people than ever are living in those cities. The closer we get people together, the more likely things are going to occur. So 10 years in, I mentioned the idea of being ready when the market catches up. This is just a picture of some of the areas we served back about 3 years ago. This is where we are today. And I won't get into all the business behind it per se, but the idea of really getting on the ground and understanding what makes the market tick. What do people actually need? Seems to be a missing link. Again, like putting a camera in the back of an ambulance, not rocket science, but the idea that you could actually talk to people about what their pain points are and listen to them rather than producing a solution and jamming it down their throats and hoping to God that the contract that you've given them is so complicated they can't get out of it and they realize you're selling them vaporware. So we spent a long time, we've been in business for 10 years, and needing to understand at a granular level the value propositions for every stakeholder along the way. There is so much talk, certainly among health IT startups, around the idea that hospitals are difficult to sell to, that cities are difficult to sell to, that consumers are difficult to sell to, yet each of those spends gobs of money every day and makes our economies go round. So how is it that some people are able to do it? And I believe the difference is getting into the back of the truck, walking into the emergency department, watching how expensive faxes are, and measuring that. And it turns out that that was a piece of advice that one of our first team members suggested to us. He basically said, don't talk about fluffy things like making people better. It's very hard to measure health. It's arguably impossible to measure health, but it's possible to measure that which contributes to health, just like it's possible to measure that which contributes to efficiency. And if you can get down to the level of, for example, reducing time associated with administration, reducing data loss, not because it makes people better, but because it's expensive. And redundancy downstream produces time lag, and time lag, especially in emergent environments, makes people worse. And so if you can focus on the things that you can measure, then you can focus on that which you can fix. For example, like $3 billion in uncompensated care that fire and EMS agencies in the United States alone absorb every year. Think about what it would be like for any business represented in this room or at this conference or in this country to run at a $3 billion economic loss on an annual basis. It wouldn't work very well. And yet, across the United States, that's what EMS and fire agencies do every year. If we can solve that problem, we can let them run. We can let them run better. We can let them run more efficiently, which lets them take care of people better, more efficiently, at lower cost. And ultimately, that's the AAA, right? So one of the pieces of advice that we got, again, sort of the drivers of what we needed to do came from a fellow named Mike Metro, who's a former chief deputy at Los Angeles County Fire, which, depending on how you measure it, is either the second or third largest fire department in the United States. And he essentially asked the question, it's the first time I met him, and he actually put his phone down on the table in front of me and said, why can I check myself into my flight this evening, but I can't check my patient into the hospital on the way in? Why indeed? And to bring it a couple years hence, why is it that Amazon can tell us where our package is along its route, but if you go to places like Connecticut, by law, EMS agencies of every type actually have to use 2 different radios to call into their hospitals on the way in. One to acknowledge the call, the other to find out which hospital to go to under law in the state of Connecticut. So there are some really compelling questions where, what if we could use, say, one technology to do both and free up the hands of the crew so that they don't need to stop what they're doing to make not just a phone call, but a radio call. And this is where the opportunity for things like artificial intelligence comes in. So we look at this process, which again, Chief Metro described to me at the time was EMS 2020. It's apparently been kicked out to EMS 2050. I think it should have been EMS 2019 third quarter, but that's just me. It's really 3 parts. One is enabling the data to be captured in real time with high fidelity without disrupting the workflow. The second is to enable that information to be moved to the person or persons or stakeholders who are going to need that information in real time, fast enough that it can be used and relied upon for not only for a CYA document or a building service after the fact, but to make decisions about how you're going to take care of people when they show up in your emergency department, and you may or may not have any idea who they are. And the third is to be able to keep track of them over time. Because again, if I know who you are and I know where you're going, I should be able to say, check on you and follow up and find out. I use an example of my father, who's a diabetic transplant patient. Hopefully nothing ever happens to him, but things being what they are, let's say something did. It would be wonderful if EMS arriving on scene had some idea of who he is. It would be even better if the emergency department that he ends up with has some idea who he is before he gets there. He's in several different registries. He's been going to the same doctor for 25, 30, 40 years. You know what I really want to know? My mom. Because as much as I love my dad, he's stubborn. He's too stubborn to wear a bracelet, and if you try finding something in his wallet, you'd have better luck with George Costanza. So wouldn't it be wonderful if all that information could be found and aggregated and brought to him in real time? Why can't we do that now? Well, we can, and that's where the opportunity to do things like patient matching and artificial intelligence come in. The first phase of our business, here's done. The first phase of our business was focused on this pure interoperability and documentation problem. Front-loading data collection so that it doesn't need to be repeated when you get to the emergency department door. So that, because what if you could do the mundane things like capturing insurance information, ID information, while you've got, in the United States at least, an average of 27 minutes for first aid and transport, yet only 45 to 60 seconds of verbal handoff at the emergency department. If you can get that information that's captured in those 27 minutes into the hospital beforehand, even if you only have 30 seconds, instead of repeating the stuff that could easily be documented, you can talk about the context that you couldn't capture very easily while you're taking care of the patient. So if you can front load that, then you can move the entire process forward, eliminate waste, improve the efficiency of care, get people in and out of the emergency departments faster, and solve an ED overcrowding problem. Plus, reduce this 50% on average data loss during that 45 to 60 seconds of verbal handoff of a half hour's information. Utilize data standards to ensure that all parties to this process have the ability to consume the data that's collected. Turns out these standards exist. Hospitals understand how to use them. Clinical document architecture based on HL7 is by definition an international standard. It's done that way for a reason. Why build things that are proprietary when you can use things that our tax dollars already paid for and that the majority of countries with modern healthcare systems around the world already have invested in? So we use those, boom. And all of a sudden, the liberation of data. My friend Jonathon Feit, former CEO and founder of Athena Health, likes to say, data likes to be free. So let them be free. Why hold tight and stop up the process? Well, the electronic health records industry started doing that 5 years ago. EMS business, a little bit behind the times, but we're getting there. And this is just a little bit about what needs to come next. So again, opportunities for AI, opportunities for technology, not only to transform data, perform patient ID matching, improve the reliability and connectivity of the ecosystem, but to protect the data. Because HIEs are a sensitive thing, mathematically very complex, and EMS agencies particularly because they are the only aspects of the healthcare system. Let this be, if it is, the only thing you take home from today. Pre-hospital care, fire and EMS, is the only part of the healthcare system that deals with the unknown patient. You may have a patient who's unconscious, who can't tell you their name. Walking into an office and matching a patient is relatively easy compared to somebody who can't speak to you, or doesn't want to speak to you, or is hostile when they speak to you, or all the other things that they see. So ensuring that the data that touches the HIE is clean, that it's filtered, that it's patient ID matched, that you don't get silly things like misspellings, mismatching patients so that a diabetic isn't a diabetic, and so on and so forth. And the next phase, which we'll be doing, which future casts, this is our vision for a further connected ecosystem, which I just want to point out that Europe is far ahead of the United States in this. Show of hands, those who've heard of a little system called OnStar. After a crash, it tells you where your vehicle is, location, airbag deployment, and newer versions, velocity of impact. Did you know there is not a single automotive telematics system on the planet that tells you anything about the people who were impacted by the crash? So we're building that. We call it Halcyon Post-Crash Intelligence. Hopefully you'll be hearing about it in the future. And it is designed to take the same pre-hospital pipes that we use to connect EMS to hospital and connect vehicle to ambulance, so that you're not only providing information about what's crashed, but who's been impacted. How many people are in that vehicle? How many of them are children? How many of them might be a hemophiliac or have an allergy that need to be kept in mind? We have literally sensors in our cars and on our persons that broadcast gobs of data, and yet EMS don't receive any of them. So that's where we intend to go. I'm happy to answer any questions if there's still time. But thank you very much for your interest and for having EMS represented at an Intelligent Health Conference. Thank you.
Ladies and gentlemen. All right. I think we can follow up after any questions for Jonathan.
Thank you.
Thank you all for staying. And at 2 o'clock, we'll be back with...
The MediView platform by Beyond Lucid Technologies, making first response more efficient and saving lives one patient at a time.